It's here we go. It was supposed to be me, but it didn't work out that way. It's okay. So hello from Erin and I both. Um, I'm trying to get out of the bright sunlight. Um, and I have, there we go. All right. So I am traveling somewhere through Middle Tennessee right now near Columbia at a truck stop. Not a typical truck stop, but at a truck stop. And I'm coming to you live stream with my phone as a hotspot. So hopefully we'll not have any hiccups here. Anyway, we've had a busy last couple of months, both Erin and I, for very different and very important reasons. I've been on the road doing a lot of teaching and exhibiting, a lot of speaking at various events. I just spoke at a Mentor Moms group, which is a kind of a subsidiary of Children's Health Defense. So I was near Nashville, Franklin, Tennessee, on Tuesday, speaking to that group, and Friday evening I'm doing a sourdough and artisanal bread making workshop. So if you're in the area and interested, send us an email. We have a few more things coming up that I won't go into right now, but the reason why Erin has been so busy, again, very different from me, is she has been pursuing some really important and exciting accreditations. I've always been proud of Erin. She's always been a wonderful daughter from the time she was a cute, wee little blonde ringlet covered girl with huge blue eyes that everybody loved to, now as an adult woman, she is a true servant. She has a servant's heart. She loves Jesus. She loves people. And like me, we just want to be helping people. And to that end, Erin has been putting her focus lately on functional nutritional therapy accreditations and restorative wellness and gut health accreditation. She's pursuing some more, several other accreditations coming up, but she recently completed the topic of today, her functional lab work coursework. She was in Boulder, Colorado last week doing clinicals there. And she came back so excited, and I am super excited for all that she has learned and now what she can do. I am super pumped. Super pumped. And so we decided that today, instead of interviewing somebody else, we're going to talk about labs, what they mean, what works, what doesn't, because one of the things that drives me nuts is whenever someone is experiencing some kind of a health issue, they always want to go to the doctor, and the doctor wants to run usually blood work and CAT scans and this and that. And the allopathic medical field today relies on testing rather than symptoms, and the testing is not always as clear and as effective as what we think it is. And so this coursework that Erin has just finished, and with more coming up, going into a couple of other types of testing, she's learning about what are the most effective tests, how to read them, what do you use for, which condition, and how do you get to the bottom of what's actually making us unwell, so that she can also then understand how to bring back health and wellness. There's just so much to it. So with that, I want to say hello again to my dear daughter, Erin. And we have a list of testing that we're going to talk about, pros and cons, and how to understand and all of that. But this is an important topic because we want you to understand that, for one thing, going to the doctor and having tests run is not necessarily going to be effective. So first, Erin, let's talk just generally about that. What are the issues with traditional lab testing that we need to be aware of?
Well, actually, I really love traditional lab testing. and I love it because it's really affordable. You can run specific blood work for specific things. So if we're only, like if you've done a bunch of labs and you have those and we're tracking something, we can go back like a couple weeks later and just spend a little bit of money and keep an eye on what we're working on specifically, because you can like pick and choose. So like regular blood work is a really great tool to assess where your body's at. The problem with traditional blood work that you're going to get done with a regular doctor is that, and that's going to show up when you get your results back, is that the ranges that's on there that says that you're in the clear or you're not. The problem is that by the time you get to the red on either side, high or low, by the time you get into the red, there's already a problem. So like, for example, like diabetes, you really don't get much information about diabetes or much help for diabetes until you're diabetic.
Yeah.
So there's not, so usually when you're in that kind of pre-diabetic range, it's like, oh, you're heading that way. We got to keep an eye on it. But like, there's a lot of factors that we can see from blood work that show that you might be headed in that direction.
Okay.
So blood work is such a great tool, but in the traditional allopathic medicine world, they look at it really differently than someone in my world who's looking at it from a functional perspective, and looks at ranges a lot differently. Okay. So I love it because it's really affordable. It tells me a lot about what's going on in your body. Gives a lot of information, but I'm just looking at it differently than what a traditional doctor might look at it. And then traditionally you would not, there's some markers that are really, really, really important to have that show like inflammation, show the health of your liver, just a couple things like that, maybe some additional like lipid numbers that aren't typically run. So like if you're asking your doctor to run numbers for you, there's a couple of markers that are really helpful to have the additional information on, but they're not typically run in a regular panel. So you would have to specifically ask your doctor to run it for you. And sometimes they'll be like, why in the world would you want that? Like,
yeah, because they don't understand.
Yeah, they don't understand. They don't like for example, if I've asked your doctor to run your fasting insulin, they don't really want to they might do it, or I mean, they should do it for you because you're paying your doctor. Your doctor is working for you. So your doctor should run whatever you want. But they might be like, well, why would you want that? Well, that can actually tell you a lot about where your how your body's processing glucose, and is it using too much insulin, that kind of thing.
That is a good example, because as you're talking, I'm thinking about that I on and off do test my fasting blood sugar level, as well as after eating any particular food, I'll go back and I'll check within 15 minutes or an hour to see how my body's handling it, what's happening. And that has helped me to overcome really severe hypoglycemia, possibly type 2 diabetes. I don't know, because I never actually was tested for that. But I'm thinking of my dad. Remember when he had pancreatic cancer, and the surgeon removed half of his pancreas, and it was damaged and needing to heal. So while we had him on a healing protocol for the cancer, which he overcame, with flying colors, 4 months later, no sign of cancer. The thing that had concerned me was how his body was handling sugars. He was on a ketogenic diet, but he just wasn't willing to give up his potato chips. He'd say it helped him swallow his pills or whatever. And he loved to have a beer in the evening. I understand all of that. But I wanted the doctors to be monitoring his blood sugar levels. I wanted them rather to have him testing. And I said, you know, I can go get you a kit. It's not hard, and it's so easy to do, blah, blah, blah. And he would say, no, no, no. Even though he didn't trust his doctors for the cancer diagnosis, he trusted them for everything else. And that ultimately killed him. But he would say, when I'd bring up testing the blood sugar, he'd say, oh, they test that when I go in the office. It's fine. Dad, you don't understand. We need to be testing. We need to be testing to see how your body's reacting to various foods that you're eating. And I suspected he would need insulin. So that is an example. The doctors always just poo-pooed that, and consequently, he had raging blood sugar at times because of the damage, and he ultimately died. Not related to the cancer, but related to everything else. So I say that to say, as I hear other people talking about other types of testing, I hear the ineptness and the lack of thoroughness coming from the doctor side.
Yeah, I mean, it's more on what a doctor's been trained
Yes.
to know. So it's not like they're like, purposefully inept. It's just that they are trained to look at the labs based on the traditional way of looking at it, which just doesn't give you a solid picture until it's too late. So back to the premise of it, I really enjoy reading and interpreting regular labs, because it's like looking at a little bit of a bigger picture, and you can tell if someone's dehydrated. You can tell if they're not eating enough protein. You can tell if there's a blood sugar insulin imbalance. You can tell inflammation. You can actually get a little bit of an idea if there's an infection. If there's an infection going on. There's quite a few signs that show up for like liver health. Like one of the markers that typically isn't run is GGT, and that's a liver marker, and that's typically only run if someone's an alcoholic or has liver damage, because when GGT is high, that pretty much indicates liver damage. But when GGT goes the other direction, when it's too low, that tells you a little bit about oxidative stress and inflammation, and if your liver is functioning properly. So it's just really fun. I just also really enjoy digging deep and looking deeper into these things and looking for patterns. So that's a really important part is the patterns. What are we seeing? Because your blood work will show a pattern of kind of what's going on. So, but labs are great because they're really affordable. Most everybody has labs done through their doctor and through their insurance. But for me to run labs for somebody that's not through insurance, it's still really affordable. So, so if you don't have insurance or you just want to run extra things, it's really not that expensive. I mean, you can run the whole metabolic panel for $20 or something like that. So, and then, like I said, if you're working on something specifically, then, you can come back a couple weeks later and just pick, just one or two things that you're working on and run it again and see what it looks like. So it's a really affordable way to kind of monitor and see your progress for something. So.
That's really interesting. And I didn't know that you could do some testing that would be that inexpensive, and you can still tell a lot from that.
Yeah, labs are super affordable. I put together kind of a whole template of kind of all of the things that I would the full gamut of what I would typically run for somebody if we're starting fresh from the beginning. And it's under $200. It's under $200 for a ton of stuff, a lot of stuff that adds in all these extra things that you wouldn't normally get through your regular doctor.
Oh, that's interesting. So you're talking primarily blood work in all of this. The blood is going to tell.
Yeah, so just your regular labs, your regular metabolic panel, your kidney panels, all of that stuff.
And that's going to tell you what's going on specifically in real time.
Right.
And that could
That's
change from day to day. And yeah, okay.
yeah. Your blood is always trying to maintain homeostasis. So it's a good snapshot in of this moment in time of what's happening versus something a little bit different, like a hair tissue mineral analysis test. So that is going to be a snapshot of your macro and micro minerals, as well as a few heavy metals.
That's a very common one in the alternative medical world. And I've wondered how accurate that can be.
Yeah, so HTMA is really, really neat. It's a pretty there's a lot of complexity to it, but basically, and that one I'm still learning the nuances of, and could probably find someone else to talk about that specifically in a lot more detail. But because you're taking hair, which is actual tissue, versus blood, that's going to give you a snapshot of the last 3 months of what your body, of how your body is holding or losing minerals.
Okay. If you find minerals or what minerals that you find in a hair tissue mineral analysis, is that going to show your body trying to process toxic metals out of your body?
A little bit, yeah. Minerals are the spark plugs, basically, to like make things go. And there's like a delicate balance of you've got your macro minerals, your sodium, potassium, magnesium, and calcium. So those are your 4 macro minerals that really like run the show. And the hair tissue mineral analysis also gives you ratios. So it's telling you like where the minerals are at individually, which is one way to look at it. But then another way is to look at the ratios to see what the ratios look like, because that tells you about your stress pattern. And they call it, there's like 2 types. There's a fast oxidizer and a slow oxidizer. And within that, there's level 1, 3, and 4. So those ratios give you an idea of your stress patterns as well. So it's so I'm pretty fascinated by the hair tissue mineral analysis information. It's really neat. So here's something that explained it. I'm gonna read this off. I just was reading this morning. And remember, the hair tissue mineral analysis is a 3-month picture. So that's one that you would, if you're working on something specifically, you would run that every like 3 to 6 months. And which is great because that's typically, it takes you a couple of months to like build up your, rebuild your mineral status and whatnot. So so it's a slow moving picture. But it's pretty, but like interpreting it is a little bit complicated, and there's a lot of nuance to it, and I'm still learning, but I'm really enjoying learning about just minerals in general and the hair tissue mineral analysis testing.
Okay. Did you find what you were looking for to read?
No, I don't see it now. I had just read it this morning. Oh, where did it go? Yeah, I don't remember. I don't know where it went, but
we can come back to it if you find it.
Yeah, but also something that a lot of people don't. Oh, here's what it was. So the hair test tells you a lot about stress, how your body handles stress, and how well your body is holding on to minerals or letting go of minerals. So if your individual mineral levels on an HTMA are really high. When you look at it at face value, you're like, oh, my calcium is super high. No, that means you're dumping calcium, actually, is what that means. Your body's pulling it and dumping it.
And why would your body be doing that?
Because your adrenals and your kidneys and your blood, they're all so very connected. So when you're super stressed out, your adrenals are going to dump minerals.
That's really interesting, and I've heard that spoken of before, but it's not something that's commonly talked about and known. So, so the hair tissue mineral analysis is going to track how your body is dealing with all of that. And when you say how your body deals with stress, let's elaborate on that a little bit. Does it mean like emotional stress, physical stress, toxin stress?
I mean, pretty much all of it. It's all kind of tied together. Your body, even though you're like, one thing I like to say, like with blood sugar, if your blood sugar is going up, but you're eating really well, you could have an emotional stressor driving that blood sugar. So when you look at your body as a whole, like you've got your digestive system, you've got your like your endocrine system, your stress system, which would, your HPA axis, your adrenals, pituitary, all that stuff. You've got your blood sugar handling system. Different systems can be driving problems in different areas. So you can have blood sugar dysregulation and stress, but that can actually be coming from stressors going on in your life versus food. Or you could be having digestive issues, and that can be driven by blood sugar distress, or it could be driven by HPA axis, like adrenal stress, and vice versa. So they all can, it's kind of like they're all very connected and can drive each other. Same thing, your digestive issues can be driving endocrine issues. They're all kind of like really very intimately connected. And so going back to stress, your body doesn't really differentiate between those stresses. It just knows that it's stressed.
Just senses the stress. Okay. All right. One test that you and I have spoken a lot about, and I've heard and read a lot about over the years also, that is super, super critical, I think, because all health begins in the gut, with the exception of the emotional component, which also affects the gut. And so the GI map is a very important test for that. Can you explain more about that for us?
Yeah. So GI map is one that I've had a lot of training on, and it's a really fascinating test. So it's a stool test, and there's quite a few stool test options out there. And the GI map is kind of the gold standard as far as stool tests go. And the reason for that is that it's a PCR test. So sometimes, like if you have a stool test in a hospital, they typically are going to look at it under a microscope, which is great because they can do it right there. But other stool tests, like if you're sending off your stool to a lab and they're looking at it under a microscope, some of the bacteria and pathogens might have already died by the time it gets there. So it's not quite as accurate of a test. So the GI map, they're actually using PCR testing for that. So they're testing DNA that's in the stool. And it picks up on so much more. It's like everybody kind of thinks that it's like, oh, pathogens, like, bacteria and whatnot, parasites. And it does all of that. It picks all of that up, but it's also picking up on like, how well are you digesting fats? How well is your body recycling beta glucuronidase, which happens in your liver? So do you have like an estrogen dominance issue there because your liver's not processing beta glucuronidase? It tells you like about your immune system with like SIGA and calprotectin and those kinds of things. It even tells you there's a marker for anti-gliadin. Gliadin is a type of gluten. So it's not a gluten. It doesn't tell you if you have a gluten allergy necessarily, but if that pops up, then you would have a gluten sensitivity for sure to that gliadin protein in gluten. It can tell you that.
Let's talk just for a moment about that, because there are different types of gluten, and primarily modern testing is looking at one form that's found, for instance, in wheat and spelt, but there are other forms of gliadin, for instance, in oatmeal, that still causes issues, but because it's not a typical gliadin or gluten molecule, it tends to be overlooked.
Mm-hmm. So that would be, so as far as that goes, you'd be looking more to a food sensitivity test for that. And when we get into the realm of food sensitivity testing, it's a little bit nuanced and complicated because of in the last couple of years, there's a lot of these like at home like food sensitivity testing, like Everly Well and things like that. So everybody's like, go get a food sensitivity test. And there's a lot of problems around a lot of food sensitivity testing. And food allergies. So a food allergy is it's an IgE allergy. And a food allergy, you're going to have a pretty much an immediate reaction or within like 2 hours. And that could be come out on your skin. It could be your stomach hurts. It could be anaphylaxis, things like that. And true food allergies are typically about 80% of the time are one of 10 foods. So that's your soy, your wheat, your corn, your dairy, and a couple of other things. So
eggs, that kind of thing. Yeah.
Most of the time, a true food allergy is going to be one of those 10 things. But for a lot of people do have food sensitivities, but it's a different part of your immune system that is going off. So that's more of the IgG and IG. There's so many different ones, IgM and IgA, if I'm saying that correctly. And what's happening in a food sensitivity is a little bit is different than what happens in the food allergy. And the food sensitivity is a delayed reaction. So it can take up to a couple of days for that to show up. But you tend to get the food sensitivities happen more when we have like leaky gut and just our guts not the tight junctions in our gut lining is not, they're loose, they're open, they're drying up because we're just have horrible digestive tracts now. So the food sensitivities tend to happen a lot more with that issue of hyperpermeability in our gut lining, which those can be healed when we heal the lining of our gut. True food allergies don't typically see those go away. They can get a little bit better, but we don't typically see those go away. But so as far as the food sensitivity testing goes, I've been trained to work with one or two specifically that are testing how your body reacts to the inflammation of that food. And it's a different part of your immune system than some of the other types. So the MRT mediated release testing, and there's another one, a KBMO fit test. So those ones are testing a different part of your immune system. So most of the food sensitivity tests, they rely actually on, they're only going to pick up on food that you've eaten in the last 2 weeks. So if you haven't had gluten in a year, it's probably not going to pick up on the gluten. If you had watermelon last week, it's probably going to pick up on the watermelon because your body naturally makes antibodies when it eats food to make sure that it takes care of any pathogens that might be in the food. So The MRT testing is testing for a different part of your immune system, and it's not reliant on food that you've eaten. So a traditional food sensitivity test, most of those, whatever you've eaten in the last 2 weeks is going to pop up. And it makes it really frustrating because you get it back and because it's happened to me. You get it back and you're like, well, that's literally everything I'm eating. So then you get really frustrated. It can be very frustrating and kind of defeating. The MRT test is going to show you some different stuff because it's not relying on what you've eaten. It's actually seeing how your blood actually reacts to these foods. So you can get like usually I'd use like an MRT 176. So it's testing for 176 different foods, flavorings, that kind of thing. It's all broken down into a bunch of different stuff. So like one of the things that I tested for a super high was basil. So really random for me. So I don't really eat a lot of basil, but that came up really high for me. And interestingly, over the weekend, one of my classmates, she brought like a lot of oils with her, and we were playing around with some of them. And we were talking about, like which ones we like. And I was like, oh, I love frankincense. I'm like everything frankincense. And I was having some histamine stuff. So we were playing around with how the oils affected my histamines and my histamine reactions. And she pulled out the basil, and I was like, I can tell you right now, I'm going to not like it. Obviously I know what basil smells like, but she opened it and I smelled it, and I like immediately was like, this is disgusting. Get it away from me.
Wow, that is amazing.
It's so interesting because it's like your body knows. Now maybe in a couple of months, when I kind of finish through my gut healing protocol, it won't be an issue and it might smell completely different. But your body really knows. It's very interesting.
Our bodies are designed with intelligence, and homeostasis is the process that we refer to that tries to keep the body in balance. It is amazing to me that built into this design is even literally the ability to smell, taste, or feel things that might be offensive to us, that are not offensive necessarily to anybody else, but you can tell. We can't always tell. And I think that sometimes it's because we're just so accustomed, so things are normalized that might otherwise bother us. But just you're talking about basil.
Yeah, but remember the MRT, this type of testing is telling me what my body right now in this moment,
at this point in time,
can't handle. So it doesn't mean that in 6 months down the road, that's not a forever thing for me. That's just like right now my body says, no, you can't do basil.
Yeah, that's very interesting. Okay, so with GI map and food sensitivity, there is some crossover. There's a relationship.
There's a relationship, yeah. Not necessarily crossover, except for the anti-gliadin that's in the GI map. But they're very intimately connected and important to do together, because if you're trying to heal your gut, but you're eating foods that are literally causing inflammation in your body, that you're going to have a much harder time healing your gut.
Okay.
And like those food, like I said, like those foods are really strange. Like garlic was another one that came up kind of in the middle for me. So I eat garlic all the time. I love garlic. I eat it all the time. But when you're going through a gut healing, you might just have to let that go for a little bit while you're healing your leaky gut, your hyperpermeability, so your body can repair itself, and then you can eat it again, and it's not going to affect your body the way it did before.
Okay.
It's not going to cause inflammation once you've healed that. So
the food sensitivity test, how are you testing? What does that test involve?
Oh yeah, that's just a blood. That's you would just go to a lab and draw blood.
Whereas the GI map involves collecting stool.
Right, right. Collecting stool, and then you just send it off in a little package, and away it goes.
We've done that before. It's so much fun. I always think about the person on the receiving end. They must really enjoy their job, but it's an important job.
But
Okay.
GI map is so interesting because of the bacteria that pops up on it, whether it's to, and there's we tend to think of good bacteria, bad bacteria. It's not necessarily good and bad. It's that we want everything to be in balance. So we want all that bacteria there, but we don't want it to be too low. We don't want it to be too high. And when those things, when they get out of balance, then that's when they can cause a lot of issues. So
that's an important distinction, and I often bring that up because people talk about pathogens. God didn't create pathogens. He created everything to be in balance. It's when things are out of balance, as you're saying, that something can become harmful that actually has a purpose within our bodies. So to try to eradicate a, quote, pathogen is not actually a good thing. Instead, we should be aiding our body in regaining the microbial balance in the gut.
Yeah, well, sometimes you still have to eradicate if H. pylori, when H. pylori is lab high, that's something you would want to eradicate. When candida is present in a GI map, because a GI map, for some reason, candida is very difficult to detect on the GI map. So that's the one where if you see candida on your GI map, you need to go after it. That means it's probably it's actually a lot higher than, even though it might not say lab high, it might just be present. But you probably actually have a lot of candida, which a lot of people do. And there's some of the bacteria, we would call them dysbiotic bacteria. When they grow too much, can cause a lot of inflammation. Like here's a pretty, here's one that shows up a lot, streptococcus. So streptococcus colonizes the skin and the mucous membranes throughout the body. High levels in the intestine may result from low stomach acid, PPI use, reduced digestive capacity, SIBO, or constipation. Or elevated levels may also be indicative of intestinal inflammatory activity and may cause loose stools. So it's really interesting because each of these bacteria kind of they will give you specific symptoms if they become overgrown. So there's certain types when they're not all of them, but certain types that are considered dysbiotic, that when they show up, we actually do want to go after and eradicate them. So not that we're trying to completely remove them, but we're trying to bring them back down. Like they're too high, causing inflammation, causing, a lot of like mental health, anxiety, depression, that kind of thing can be driven by dysbiotic bacteria and candida. Candida for sure.
That's interesting. And then the traditional medicine approach to eradicating that is something that can exacerbate other issues. And so you want to be working with a good functional nutritionist or functional medicine doctor who understands that, rather than just throwing more pills at it.
Also, an interesting thing about H. pylori that the GI map tells you, there's lots of different strains of H. pylori. And you can have just straight H. pylori, can be lab high. But you can also have some subcategories called virulence factors. And with those, if you have one that shows up with a virulence factor, that type of H. pylori can be pathogenic. So it can turn into cancer. So especially when you see those subcategories of H. pylori with the virulence factor, you need to get rid of those. But what the GI map also tells you that's really interesting is that some strains of some H. pylori, and this is different for each person, it's dependent on the person, it's very individual. Some people will not respond to antibiotics or certain types of antibiotics to get rid of H. pylori. So the GI map actually tells you if that's, individual for the person, if they have those antibiotic resistant strains of H. pylori. So for me, I had several that came up for several different types of and obviously I'm not going to take an antibiotic for it. But if I had a client that did want to take antibiotics to eradicate the H. pylori, which would, if that's what somebody wants to do, that's what they want to do. Well, then they can take that information to their doctor and say, hey, look, this shows that this type of antibiotic isn't even going to work for H. pylori for me.
That's interesting also in that my understanding is that antibiotic use can actually cause candida overgrowth and H. pylori. So perhaps it's dependent upon the quantity of an antibiotic as well as type of antibiotic that might be affecting that, and then as opposed to what might help it.
Right. And if you go on an antibiotic for anything and you immediately get like a UTI, you have candida already. It was already there.
Ah, I did not know that. Mm-hmm. Restate that just so that we don't forget.
Yeah. So if you go on a round of antibiotics and you immediately get a UTI, you already have candida in your system. And that is a problem for a lot of people that go on antibiotics. They do go on the antibiotic and they come off and they get UTIs. But you've already got candida.
Okay. That's interesting. And the other thing that you stated a few minutes ago was about how H. pylori can actually cause cancer, certain strains.
Certain strains, they're called virulence factors, can cause cancer. So you do need to go after those. That's a scenario where you definitely need to eradicate.
Okay. And I'm wanting at a later date to really delve into what cancer actually is. Today's not the day for that. But my understanding of what cancer is and then how you actually should be dealing with it is very different from mainstream thinking. And it's an area that's, I think, is super important, but we need to address that at a later date and pull somebody on who's a real expert on that as well. And, perhaps you can come on and interact in that discussion, but
cancer is so nuanced. That's not,
that is exactly the word I was going to use.
Like if you have cancer and you want to work with it from a natural perspective, you have to work with somebody, whether a practitioner or a doctor that knows what they're doing, because it is very complicated. You do not want to try to DIY that. You need to find somebody that knows what they're doing from a natural perspective. And like Dr. Nasha Winters, her what's it called? The Terrain Institute or something like that. Like that's what she has a whole network of doctors that are trained to do that. And she has
we'll interview her soon. I talked with her. I see her from time to time, and I talked with her last year about coming on. So that's a topic I think I'd like to address with her at a later date. We'll get that set up, and we'll let all of you know. That'll be a good discussion too. Moving on, as we're running out of time, let's talk about LNT, lingual neuron testing.
Lingual-Neural testing. So this is what I just finished up this weekend, and it was so amazing. So this is a special training that the NTA provides, and it used to be part of their regular curriculum, but after COVID happened, and a lot of people are now seeing people virtually. It's not something that you can do virtually. It has to be in person. But it's really amazing because there's all these points on your body, and mostly we're working with points on the ribs, on the stomach, some like along the sides of the legs. And these points are where lymphatic tissue and nerves cross that are connected to organs. So for example, your sinus points are right here in the first intercostal space, right here. So for a client, I would palpate on the points to get a baseline. So then it would be, I'm gonna gently palpate on your points, and I need you to give me a number from 0 to 10, how much it hurts. And when I say hurts, it would feel like you're pushing into a bruise, something like that. So I'm going to go through I'm going to go through the system, going through like digestion from north to south. I'm going to do your blood sugar points. I'm going to do your adrenals, which are connected to your stress, and then your immune system and endocrine points, and get a baseline for everything so that we can see like kind of what organ and system needs help. And obviously you would have filled out paperwork before also, so I would have a pretty good idea of what's going on. But actually doing this palpation actually tells me what your body is saying right now. And then I can come in. So like if your liver point, if your liver and gallbladder points are like we say hot, like they hurt, then, you know, there's a couple of things. Well, there's several things that would work for liver, but I'm going to come in, I'm going to grab one of the supplements from my test kit and have you hold it. And then I'm going to go back on those points and repalpate the liver points. And now you're going to give me your number again, and we'll compare it to the baseline. So sometimes it might stay the same. Sometimes it might go up. But if it goes down, then we know that's the supplement that your body wants. So we're actually building a really very customized protocol through this process. So it's really neat because, you know, like I said, there could be like 4 or 5 different things that would work, that would be great for your liver, but we're looking for exactly what it is that your body wants, and we're testing it. And then we're building that protocol and going back to make sure that everything, that your whole body is that what you're doing is what your whole body wants. And you're really not walking away with like would never give more than like 4 or 5 things at once. That would be a lot. And then you can reevaluate again in a couple of weeks or a month, and your body might be saying something completely different, and you might not even need those anymore. Might not need anything.
That's really interesting. The holistic doctor that Dad used to go to and that Grandma Ginny was using, he would do some testing in the office every time we came in. And then now with us, he knew that we didn't want to spend loads of money just on every supplement, blah, blah, blah. So he knew that with us, he would prescribe very specific things, and which we would go home with. And otherwise, I would make changes in diet or in habits or whatever. Whereas with Grandma, she was walking out with $800 in supplements every time. And it was changing every time she went in. So, you know, obviously we don't want to go to that extreme. We don't want to be wasting money. What you are describing is providing very targeted, very specific information. And rather than wasting money and time, but especially wasting money, you're able to determine what the body really needs right now in this moment. And then we can make corrections next time around. It's really interesting that you can tell that specifically, that the body will respond. The body knows
what it wants. And like one of the really interesting ones is called the leg length test, or the posterior ilium, and it's actually an adrenal test. And basically, you can't do it to yourself. I can do some of these to myself, but that one I can't. So client would, you know, lie down and look at their ankles, and that ankle bone on the inside, are they even, or is one leg a little bit shorter? A lot of people have a little bit shorter leg than the other. That's pretty common. And how many times, well, this used to be me years ago, go to the chiropractor and he'd straighten it out for me. You go to the chiropractor every single day to straighten out that leg, but that's not the problem. The problem is your adrenals. And it's like you can literally watch somebody's leg straighten out when you put an adrenal supplement on them. So that's like a pretty amazing little test.
That sounds fascinating. Actually, everyone, we're going to all be together for our entire family vacation in about 5 or 6 weeks. And Erin is going to be testing some of us um, using this method. And I'm pretty sure that you're going to find some adrenal issues and fairly serious with me. So I'm eager to see what you're reading, what you will read when you look at me and when you look at your dad. Um, that's just a whole nother issue. If you want to read about him, friends, go to our blog, The Most Wonderful Terrible Thing, that gives kind of the background and the history with him. Um, but I am encouraged and feel motivated by just the fact that you can do this particular test and discover so much. And I'm excited about the other two. I always wanted to have a GI map done. George did. I haven't. But using these testing methods, which is different than going into an allopathic medicine doctor's office, by far, far different. We can see exactly what the body needs to get back back to health, back into homeostasis. Our bodies, from the moment we're born until the moment we die, our bodies are always seeking to be in balance and working properly. And we just need the tools to understand, first of all, what is the body really telling us? And then what does the body need to correct? Now, we've also got two other tests, which we won't go into as much, the Dutch test and the organic acids test, the oat test. If you want to address either or both of those briefly.
Yeah, so I won't have specific training on those until springtime. But the Dutch test is basically testing your sex hormones and your adrenals. So it'll test your cortisol. It's going to test your estrogen, progesterone, all of the, there's not just estrogen, there's like estradiol and all that stuff. So the Dutch test is testing, it's a urine test that you do at home, and it's testing for your, basically where your hormones are at. So obviously that would be something helpful to do for like fertility testing, like for if you're, trying to conceive, people who are, having a lot of like period issues, PMS, that kind of thing. So when you're going through, premenopause and menopause, and then even for men as well. So that one's specifically those hormones and going to be kind of used in those circumstances. And then the oat test, the organic acids test, is a little bit complicated. It's another urine test. And that's testing for organic acids in your body, which is really more of like how your mitochondria is functioning. A lot of people who deal with mold get these tests done. Tells you a little bit about detoxification. So it's like a little bit different scenario, and it's another pretty complicated test. So like I said, I won't have training on that until springtime. But those are two other tests that you typically see in the functional medicine world.
Okay, that's really interesting too. All of these methods of testing that can give us so much information to really help us to heal. They're very important. And Erin, I'm really thankful that you're learning all of this. Now, a lot of practitioners know some of this. A few practitioners know most or all of this.
And you don't have to do all of that testing, because the testing is, all that stuff is expensive. The GI map is expensive. The Dutch, those are expensive tests. So that's why keeping it a little bit more simplified, like the regular blood work is so much cheaper. And then you can rerun what you need to have rerun for even less. But it really depends on what you're wanting to work on. So if your gut is messed up, which gut, we always, no matter what your issue is, you're always going to start at the gut. So that's why the GI map is such a useful test, and just like, how it resolves so many issues for people is amazing. So that's always going to be kind of like a go-to for your starting point for a lot. And then if you're still struggling with stuff, then maybe you move on to, to the Dutch tests if they're still going on or something like that. But
yeah, I can see where that would be an important test for some people, for especially today, for a lot of reasons. But just starting with the GI map may be the most expensive test.
probably the Dutch or the Ode is actually more expensive. GI map, about $400.
Okay.
Mm-hmm.
But really, I think very important. I have said for years, and I think you would agree, that health begins in the gut. But now I am saying health begins in the gut and the heart and the brain, because there's another aspect to this that we'll really delve into later as well, which is the emotional and the trauma, past trauma and resolving.
Well, your gut is directly connected to your brain via your vagus
Yes.
nerve. So that's why so much that happens in your gut and so much that happens here affects each other.
Affects all of it, yes. So there is that direct connection, and we have to consider all emotional, spiritual, as well as physical. I've often heard stories of people resolving their past hurts and traumas. Actually, today I was having a conversation with my friend that I stayed with about this very thing. And when you actually get to the point where you deal with the emotional stuff, the physical stuff starts to work its way out as well. And sometimes working on the physical stuff helps us to deal with the emotional stuff, and then we can come into balance eventually. But it's a process. It's an important process. We were designed to thrive. And, you and I want, and others want to help people learn how to thrive in every way. So why there are so many guidelines in the Old Testament as well as in the New, but in particular the Old Testament. It's not just, it is food, it is pathogen, it is protecting from mold, it is also spiritual and emotional health. It's all there. It's all there. We're not an organism that only is affected by the air. We are very affected by the air that we breathe, the water that we drink, the food that we eat, but we're also affected by the electromagnetic field, by our spiritual life, our emotional life, all of these things working together. But there is a direct connection between the gut, the brain, the vagus nerve connection. All of this is connected, and we want to put the pieces together to help one another to be whole and healthy, to be thriving, so that we can be servants. We need to be served at times and accept that, but we want to be strong physically, emotionally, spiritually, so we can be good stewards and good servants to God's kingdom. Does that make sense? That's where you and I are coming from, I think. And I'm just excited to see where we go from here, where you go from here, and how you will be able to help people, beginning with our own family. That we've got things to deal with, that we are dealing with, but that need more help. So I'm excited for this. I think we're gonna end here. I'll mention that next week we are bringing to you an interview with Michael Kilpatrick, whose farm and private co-op in Ohio, of course, recently, just last month, was shut down temporarily by the Ohio Department of Agriculture and Warren County, Ohio, governmental organization. We're going to talk about food freedom, food rights, farmer rights, and all of that stuff, and what we need to do to have access to good food and good medicines of our choosing. All of that is connected. So this is what we'll talk about next week. But for today, Erin, I'm thankful. Erin doesn't like to come on all that often. She'd rather be running things in the background, making sure that I don't mess up or that she can correct my errors. But I was very grateful this week for you to come on, Erin, and talk about this. This is an important, very important part of our healing journeys for all of us. So thank you. And thank you to everyone who tuned in and who may be listening later. We hope that you liked this video, and if that is the case, please give us a thumbs up. Please do subscribe, and please do share widely. We're wanting to get this information out far and wide so that we can be helpful to others. That's our whole goal. So thank you. And we look forward to being with you again next week with Michael Kilpatrick. Bye-bye, and God bless.